In this series, we are here to help you clear your NMC CBT exam. Every alternate day, we'll present you with 20 multiple-choice questions and their answers to boost your knowledge and to supercharge your progress. We've got a weekly master video with a whopping 120 MCQs. Don't miss out on this opportunity to excel. Let's dive right in. Question 1. Which of the following is a sign of dehydration in the elderly? Option A, diminished skin turgor. Option B, hypertension. Option C, anxiety attacks. Option D, pyrexia. The correct answer is A. Question 2. The nurses on the day shift report that the controlled drug count is incorrect. What is the most appropriate nursing action? Option A, report the discrepancy to the nurse manager and pharmacy immediately. Option B, report the incident to the local board of nursing. Option C, inform a doctor. Option D, report the incident to the NMC. The correct answer is A. Question 3. When using crutches, what part of the body should absorb the patient's weight? Option A, armpits. Option B, hands. Option C, back. Option D, shoulders. The correct answer is B. Question 4. Under the carer's equal opportunities. Act 2004. What are carers entitled to? Option A, their own assessment. Option B, financial support. Option C, respite care. Option D, all of the above. The correct answer is D. Question 5. How can patients who need assistance at meal times be identified? Option A, a red sticker. Option B, a color serviette. Option C, a red tray. Option D, any of the above. The correct answer is D. Question 6. How should eye drops be administered? Option A, pulling on the lower eyelid and administering the eye drops. Option B, pulling on the upper eyelid and administering the eye drops. Option C, tip the patient's head back and administer the eye drops into the cornea. Option D, tip the patient's head to the side and administer the eye drops into the nasolacrimal system. The correct answer is A. Question 7. Which of the following are not signs of a speed shock? Option A, flushed face. Option B, headache and dizziness. Option C, tachycardia and fall in blood pressure. Option D, peripheral edema. The correct answer is D. Question 8. Compassion in practice. The culture of compassionate care encompasses Option A, care, compassion, competence, communication, courage. Commitment to compassion in practice. Option B, care, compassion, competence. Option C, competence, communication, courage. Option D, care, courage, commitment. The correct answer is A. Question 9. When collecting an MSU from a male patient, what should they do prior to the specimen being collected? Option A. Clean the meatus and catch a specimen from the last of the urine voided. Option B. Clean the meatus and catch a specimen from the first stream of urine approx. 30 mls. Option C. Clean the meatus and catch a specimen of the urine midstream. Option D. Ask the patient to void into a bottle and pour urine specimen into the specimen container. The correct answer is C. Question 10. A patient puts out his arm so that you can take his blood pressure. What type of consent is this? Option A. Verbal. Option B. Written. Option C. Implied. Option D. None of the above. Or consent is no required. The correct answer is C. Question 11. On checking the stock balance in the controlled drug record book as a newly qualified nurse, you and a colleague notice a discrepancy. What would you do? Option A. Check the cupboard, record book, and order book. If the missing drugs aren't found, contact pharmacy to resolve the issue. You will also complete an incident form. Option B. Document the discrepancy on an incident form and contact the senior pharmacist on duty. Option C. Check the cupboard, record book, and order book. If the missing drugs aren't found, the police need to be informed. Option D. Check the cupboard, record book, and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. The correct answer is A. Question 12. Which of the following is a severe complication during 24 hours? Post-liver biopsy. Option A. Pain at insertion site. Option B. Nausea and vomiting. Option C. Back pain. Option D. Bleeding. The correct answer is C. Question 13. A patient recently admitted to hospital, requesting to self-administer the medication, has been assessed for suitability at level 2. This means that Option A. The registrant is responsible for the safe storage of the medicinal products and the supervision of the administration process, ensuring the patient understands the medicinal product being administered. Option B. The patient accepts full responsibility for the storage and administration of the medicinal products. Option C. None of the above. The registrant is responsible for the safe storage of the medicinal products. At administration time, the patient will ask the registrant to open the cabinet or locker. The patient will then self-administer the medication under the supervision of the registrant. The correct answer is C. Question 14. What is the name given to a decreased pulse rate or heart rate? Option A. Tachycardia. Option B. Hypotension. Option C. Bradycardia. Option D. Arrhythmia. The correct answer is C. Question 15. Mergreen, a COPD patient, was sent home with oxygen prescription at 2 liters per minute. He is dyspneic, anxious, and panicking when you visited him. What is your most immediate nursing action to relieve dyspnoea? Option A. Call the emergency department for an ambulance. Option B. Increase oxygen rate. Option C. Tell patient to calm down in a loud voice. Option D. Calmly instruct patient to do deep breathing. The correct answer is D. Question 16. What is the most common complication of venipuncture? Option A. Nerve injury. Option B. Arterial puncture. Option C. Hematoma. Option D. Fainting. The correct answer is C. Question 17. What are the principles of gaining informed consent prior to a planned surgery? Option A. Gaining permission for an imminent procedure by providing information in medical terms. Ensuring a patient knows the potential risks and intended benefits. Option B. Gaining permission from a patient who is competent to give it by providing information, both verbally and with written material relating to the planned procedure, for them to read on the day of planned surgery. Option C. Gaining permission from a patient who is competent to give it, by informing them about the procedure and highlighting risks if the procedure is not carried out. Option D. Gaining permission from a patient who is competent to give it, by providing information in understandable terms prior to surgery, allowing time for answering questions and inviting voluntary participation. The correct answer is D. Question 18. Which of the following is not one of the 6 fundamental values for nursing, midwifery, and care staff, set out in Compassion in Practice Nursing, Midwifery, and Care Staff? Option A. Care. Option B. Consideration. Option C. Communication. Option D. Compassion. The correct answer is B. Question 19. At what stage of the nursing process does the revision of the care plan occur? Option A. Assessment. Option B. Planning. Option C. Implementation. Option D. Evaluation. The correct answer is D. Question 20. When selecting a stoma appliance for a patient who has undergone a formation of a loop colostomy, what factors would you consider? Option A. Patient dexterity, consistency of effluent, type of stoma. Option B. Patient preference, type of stoma, consistency of effluent, state of or istomal skin, dexterity of the patient. Option C. Patient preference, lifestyle, position of stoma, consistency of effluent, state of peristomal skin, patient dexterity, type of stoma. Option D. Cognitive ability, lifestyle, patient dexterity, position of stoma, state of peristomal skin, type of stoma, consistency of effluent, patient preference. The correct answer is D. Question 21. Approximately how many people in the UK are malnourished? Option A. 1 million. Option B. 3 million. Option C. 5 million. Option D. 7 million. The correct answer is B. Question 22. In a patient with hourly monitoring, When does a nurse formally document the monitoring? Option A, every hour. Option B, when there are significant changes to the patient's condition. Option C, at the end of the shift. The correct answer is A. Question 23. Recommended preoperative fasting times are: Option A, 2 to 4 hours. Option B, 6 to 12 hours. Option C, 12 to 14 hours. The correct answer is B. Question 24. People with blood group A are able to receive blood from the following: Option A, Group A only. Option B, Groups A, B, or B. Option C, Groups A or O. Option D, Groups A, B, or O. The correct answer is C. Question 25. What is meant by an advocate? Option A, someone who develops opportunities for the patient. Option B, someone who has the same beliefs as the patient. Option C, someone who does something on behalf of the patient. Option D, someone who has the same values as the patient. The correct answer is C. Question 26. Wound proliferation starts after: Option A, 1 to 5 days. Option B, 3 to 24 days. Option C, 24 days. The correct answer is B. Question 27. What is the role of the NMC? Option A, to regulate hospitals or other healthcare settings in the UK. Option B, to regulate healthcare assistants. Option C, to represent or campaign on behalf of nurses and midwives. Option D, to regulate nurses and midwives in the UK to protect the public. The correct answer is A. Question 28. How many cups of fluid do we need every day to keep us well hydrated? Option A, 1 to 2. Option B, 2 to 4. Option C, 4 to 6. Option D, 6 to 8. The correct answer is D. Question 29. What is abduction? Option A, division of the body into front and back. Option B, movement of a body part towards the body's midline. Option C, division of the body into left and right. Option D, movement of a body part away from the body's midline. The correct answer is D. Question 30. The nurse is caring for a diabetic patient and when making rounds, notices that the patient is trembling and stating they are dizzy. The next action by the nurse would be: Option A. Administer patient scheduled metformin. Option B. Give the patient a glass of orange juice. Option C. Check the patient's blood glucose. Option D. Call the doctor. The correct answer is C. Question 31. What is clinical benchmarking? Option A. The practice of being humble enough to admit that someone else is better at something, and being wise enough to try to learn how to match and even surpass them at it. Option B. A systematic process in which current practice and care are compared to and amended to attain best practice and care. Option C. A system that provides a structured approach for realistic and supportive practice development. Option D. All of the above. The correct answer is D. Question 32. What is the purpose of the NMC code? Option A. It outlines specific tasks or clinical procedures. Option B. It ascertains in detail a nurse's or midwife's clinical expertise. Option C. It is a tool for educating prospective nurses and midwives. The correct answer is C. Question 33. What are the steps of the nursing process? Option A. Assessing, diagnosing, planning, implementing, and evaluating. Option B. Assessing, planning, implementing, evaluating, documenting. Option C. Assessing, observing, diagnosing, planning, evaluating. Option D. Assessing, reacting, implementing, planning, evaluation. The correct answer is A. Question 34. Who has the overall responsibility for the safe and appropriate management of controlled drugs within the clinical area? Option A. All registered nurses. Option B. The nurse in charge. Option C. The consultant. Option D. All staff. The correct answer is B. Question 35. A client experiences an episode of pulmonary edema because the nurse forgot to administer the morning dose of furosemide Lasix. Which legal element can the nurse be charged with? Option A. Assault. Option B. Slander. Option C. Negligence. Option D. Tort. The correct answer is C. Question 36. Which of the following oxygen masks is able to deliver between 60 to 90% of oxygen when delivered at a flow rate of 10 to 15 liters per min? Option A. Simple semi-rigid plastic masks. Option B. Nasal cannulas. Option C. Venturi high-flow mask. Option D. Non-rebreathing masks. The correct answer is D. Question 37. You walk onto one of the bay on your ward and noticed a colleague wrongly using a hoist in transferring their patient. As a nurse you will. Option A. Let them continue with their work as you are not in charge of that bay. Option B. Report the event to the unit manager. Option C. Call the manual handling specialist nurse for training. Option D. Inform the relatives of the mistake. The correct answer is B. Question 38. If you were asked to take standard precautions, what would you expect to be doing? Option A. Wearing gloves, aprons, and masks when caring for someone in protective isolation. Option B. Taking precautions when handling blood and high-risk body fluids, so as not to pass on any infection to the patient. Option C. Using appropriate hand hygiene, wearing gloves and aprons where necessary. Disposing of used sharp instruments safely and providing care in a suitably clean environment to protect yourself and the patients. Option D. Asking relatives to wash their hands when visiting patients in the clinical setting. The correct answer is C. Question 39. What fluid should ideally be used when irrigating eyes? Option A. Sterile 0.9% sodium chloride. Option B. Sterile water. Option C. Chloramphenicol drops. Option D. Tap water. The correct answer is B. Question 40. Barrier nursing for C.diff patients, what should you not do? Option A. Use of hand gel alcohol rubs. Option B. Use gloves. Option C. Patient has his own set of washers. Option D. Strict disinfection of PT.S room after isolation. The correct answer is A. Question 41. Which of the following is not a part of the 6 rights of medication administration? Option A. Right time. Option B. Right route. Option C. Right medication. Option D. Right reason. The correct answer is D. Question 42. Which is the first drug to be used in cardiac arrest of any etiology? Option A. Adrenaline. Option B. Amiodarone. Option C. Atropine. Option D. Calcium chloride. The correct answer is A. Question 43. Independent advocacy is Option A. Providing general advice. Option B. Making decisions for someone. Option C. Care and support work. Option D. None of the above. The correct answer is D. Question 44. What is the clinical benefit of active ankle movements? Option A. To assist with circulation. Option B. To lower the risk of a DVT. Option C. To maintain joint range. Option D. All of the above. The correct answer is D. Question 45. Examples of offensive hygiene waste, which may be sent for energy recovery at energy from waste facilities can include Option A, stoma or catheter bags. The management of waste from health, social and personal care (RCN). Option B, unused non-cytotoxic, cytostatic medicines in original packaging. Option C, used sharps from treatmenting cytotoxic or cytostatic medicines. Option D, empty medicine bottles. The correct answer is A. Question 46. A nurse documents vital signs without actually performing the task. Which action should the charge nurse take after discussing the situation with the nurse? Option A, charge the nurse with malpractice. Option B, document the incident. Option C, notify the board of nursing. Option D, terminate employment. The correct answer is B. Question 47. When should adult patients in acute hospital settings have observations taken? Option A. They are admitted or initially assessed. A plan should be clearly documented which identifies which observations should be taken and how frequently subsequent observations should be done. Option B. When they are admitted and then once daily unless they deteriorate. Option C, as indicated by the doctor. Option D, temperature should be taken daily, respirations at night, pulse and blood pressure for who? The correct answer is A. Question 48. The CQC describes compassion as what? Option A, intelligent kindness. Option B, smart confidence. Option C, creative commitment. Option D, gifted courage. The correct answer is A. Question 49. The code contains the professional standards that registered nurses and midwives must uphold. UK nurses and midwives must act in line with the code, whether they are providing direct care to individuals, groups, or communities, or bringing their professional knowledge to bear on nursing and midwifery practice, in other roles, such as leadership, education, or research. What four key areas does the code cover? Option A, prioritize people, practice effectively, preserve safety, promote professionalism and trust. Option B, prioritize people, practice safely, preserve dignity, promote professionalism and trust. Option C, prioritize care, practice effectively, preserve security, promote professionalism and trust. Option D, prioritize care, practice safely, preserve security, promote kindness and trust. The correct answer is A. Question 50. In spinal cord injury patients, what is the most common cause of autonomic dysreflexia? A sudden rise in blood pressure. Option A, bowel obstruction. Option B, fracture below the level of the spinal lesion. Option C, pressure sore. Option D, urinary obstruction. The correct answer is D. Question 51. How do you test the placement of an enteral nasogastric tube? Option A, monitoring. Option A, monitoring bubbling at the end of the tube. Option B, testing the acidity Alkalinity of aspirate using blue litmus paper. Option C. Interpreting absence of respiratory distress as an indicator of correct positioning. Option D. Have an abdominal X-ray. The correct answer is B. Question 52. After finding the patient, which statement would be most appropriate for the nurse to document on a DATIXI incident form? Option A. The patient climbed over the side rails and fell out of bed. Option B. The use of restraints would have prevented the fall. Option C. Upon entering the room, the patient was found lying on the floor. Option D. The use of a sedative would have helped keep the patient in bed. The correct answer is C. Question 53. Why are support stockings used? Option A. To aid mobility. Option B. To promote arterial flow. Option C. To aid muscle strength. Option D. To promote venous flow. The correct answer is D. Question 54. During enteral feeding in adults, at what degree angle should the patient be nursed at to reduce the risk of reflux and aspiration? Option A. 25. Option B. 35. Option C. 45. Option D. 55. The correct answer is C. Question 55. To whom should you delegate a task? Option A. Someone who you trust. Option B. Someone who is competent. Option C. Someone who you work with regularly. Option D. All of the above. The correct answer is B. Question 56. A nurse is leading a program about management issues. The nurse would intervene if a ward nurse made which of the following statements? Option A. It is my responsibility to ensure that the consent form has been signed and attached to the patient's chart prior to surgery. Option B. It is my responsibility to witness the signature of the client before surgery is performed. Option C. It is my responsibility to answer questions that the patient may have prior to surgery. Option D. It is my responsibility to provide a detailed description of the surgery and ask the patient to sign the consent form. The correct answer is D. Question 57. After a lumbar puncture, your patient becomes unconscious. What will be the reason? Option A. Increased intracranial pressure ICP. Option B. Headache. Option C. Side effects of medication. Option D. Cerebral spinal fluid leakage. The correct answer is D. Question 58. Anti-embolic stockings an effective means of reducing the potential of developing a deep vein thrombosis because Option A. They promote arterial blood flow. Option B. They promote venous blood flow. Option C. They reduce the risk of postoperative swelling. Option D. They promote lymphatic fluid flow and drainage. The correct answer is B. Question 59. Patient is prescribed metformin 1,000 milligrams twice a day for his diabetes. While talking with the patient, he states, "I never eat breakfast. So I take a 12-tablet at lunch and a whole tablet at supper because I don't want my blood sugar to drop." As his primary care nurse, you Option A, tell him he has made a good decision and to continue. Option B, tell him to take a whole tablet with lunch and with supper. Option C, tell him to skip the morning dose and just take the dose at supper. Option D, tell him to take one tablet in the morning and one tablet in the evening as ordered. The correct answer is D. Question 60. In what order should the 4 phases of wound healing be? Option A, inflammation, proliferation, hemostasis, maturation. Option B, hemostasis, inflammation, proliferation, maturation. Option C, proliferation, hemostasis, maturation, inflammation. Option D, maturation, inflammation, proliferation, hemostasis. The correct answer is B. Question 61. Which of the following are signs of anaphylaxis? Option A, swelling of tongue and rashes. Option B, dyspnoea, hypotension, and tachycardia. Option C, cold and clammy skin. Option D, all of above. The correct answer is D. Question 62. When will you consider giving out information off the patient? To a police officer. Option A, if he has a rank of an inspector. Option B, if safety of the public is at risk. The correct answer is B. Question 63. An overall risk of malnutrition of 2 or higher signifies. Option A, low risk of malnutrition. Option B, medium risk of malnutrition. Option C, high risk of malnutrition. The correct answer is C. Question 64. Which of the following is not a component of end-of-life care? Option A, resuscitation and defibrillation. Option B, reduce pain, maintain dignity. Option C, provide family support. The correct answer is A. Question 65. How much urine should someone void an hour? Option A, 0.51 ml per kg per hour of the patient's body weight. Option B, 2 milliliters per kg per hour of the patient's body weight. Option C, 30 mls. Option D, 50 mls. The correct answer is A. Question 66. Patients usually urinate at night. Nurse identifies this as. Option A, polyuria. Option B, oliguria. Option C, dysuria. Option D, nocturia. The correct answer is D. Question 67. The nurse has made an error in documenting client care. Which appropriate action should the nurse take? Option A. Draw a line through error, initial, date, and document correct information. Option B. Document a late addendum to the nursing note in the client's chart. Option C. Tear the documented note out of the chart. Option D. Delete the error by using whiteout. The correct answer is A. Question 68. What infection control steps should not be taken in a patient with diarrhea caused by Clostridium difficile? Option A. Isolation of the patient. Option B. All staff must wear aprons and gloves while attending the patient. Option C. Oral administration of metronidazole, vancomycin, fidaxomicin may be required. Option D. None of the above. The correct answer is D. Question 69. In DVT, TED stockings affect circulation by: Option A. Increasing blood flow velocity in the legs by compression of the deep venous system, thromboembolism deterrent hose. Option B. Decreasing blood flow velocity in legs by compression of the deep venous system. The correct answer is A. Question 70. Which finding should the nurse report to the provider prior to a magnetic resonance imaging MRI? Option A. History of cardiovascular disease. Option B. Allergy to iodine and shellfish. Option C. Permanent pacemaker in place. Option D. Allergy to dairy products. The correct answer is C. Question 71. What percentage of the air we breathe is made up of oxygen? Option A. 16%. Option B. 21%. Option C. 26%. Option D. 31%. The correct answer is B. Question 72. The signs and symptoms of ectopic pregnancy except: Option A. Vaginal bleeding. Option B. Positive pregnancy test. Option C. Shoulder tip pain. Option D. Protein excretion exceeds 2 grams per day. The correct answer is D. Question 73. Which layer of the skin contains blood and lymph vessels, sweat, and sebaceous glands? Option A. Epidermis. Option B. Dermis. Option C. Subcutaneous layer. Option D. All of the above. The correct answer is B. Question 74. A wound care management plan should be done with what type of wound? Option A. Complex wound. Option B. Infected wound. Option C. Any type of wound. The correct answer is C. Question 75. What is meant by Gillick competent? Option A. Children under the age of 12 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Option B. Children under the age of 16 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Option C. Children under the age of 18 who are believed not to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Option D. Children under the lawful age of consent who are believed not to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. The correct answer is B. Question 76. Except which procedure must all individuals proving nursing care must be competent at? Option A. Hand hygiene. Option B. Use of protective equipment. Option C. Disposal of waste. Option D. Aseptic technique. The correct answer is D. Question 77. In nonverbal communication, what does SOLAR stand for? Option A. Squarely, open posture, leaning slightly forward, eye contact, relaxed. Option B. Squarely, open-ended questions, leaning slightly forward, eye contact, relaxed. Option C. Squarely, open posture, leaning forward, eye contact, rested. Option D. Squarely, open-ended questions, leaning slightly backwards, rested. The correct answer is A. Question 78. How do you remove a negative pressure dressing? Option A. Remove pressure, then detach dressing gently. Option B. Get TV and nurse to remove dressing. Option C. Removes in a quick fashion. The correct answer is A. Question 79. Functions should a dressing fulfill for effective wound healing? Option A. High humidity, insulation, gaseous exchange, absorbent. Option B. Anaerobic, impermeable, conformable, low humidity. Option C. Insulation, low humidity, sterile, high adherence. Option D. Absorbent, low adherence, anaerobic, high humidity. The correct answer is A. Question 80. Which of the following is no longer a recommended method of mouth care? Option A. Chlorhexidine solution and foam sticks. Option B. Sodium bicarbonate. Option C. Normal saline mouthwash. Option D. Glycerin and lemon swabs. The correct answer is D. Question 81. Which of the following displays the proper use of the Zimmer frame? Option A. Using a 1-point gate. Option B. Using a 2-point gate. Option C. Using a 3-point gate. Option D. Using a 4-point gate. The correct answer is C. Question 82. When would it be beneficial to use a wound care plan? Option A on initial assessment of wound. Option B after surgery. Option C during wound infection, dehiscence, or evisceration. Option D all of above. The correct answer is D. Question 83. The human body is made up of approximately what proportion of water? Option A 50%, Option B 60%, Option C 70%, Option D 80%. The correct answer is B. Question 84. Concentration of electrolytes within the body vary depending on the compartment within which they are contained. Extracellular fluid has a high concentration of which of the following? Option A potassium, Option B chloride, Option C sodium, Option D magnesium. The correct answer is C. Question 85. A patient had just undergone lumbar laminectomy. What is the best nursing intervention? Option A move the body as a unit. Option B move one body part at a time. Option C move the head first and the feet last. Option D never move the patient at all. The correct answer is A. Question 86. What is nocturia? Option A urinary frequency. Option B urination at night. Option C poor urine output. Option D non-passage of urine. The correct answer is B. Question 87. It is important that patients are effectively fasted prior to surgery in order to. Option A reduces the risk of vomiting. Option B reduces the risk of reflux and inhalation of gastric contents. Option C prevents vomiting and chest infections. Option D prevents the patient gagging. The correct answer is B. Question 88. A client with a right arm cast for fractured humerus states, "I haven't been able to straighten the fingers on my right hand since this morning." What action should the nurse take? Option A assess neurovascular status to the hand. Option B ask the client to massage the fingers. Option C encourage the client to take the prescribed analgesic. Option D elevate the right arm on a pillow to reduce edema. The correct answer is A. Question 89. The use of an alcohol-based hand rubs for decontamination of hands before and after. Direct patient contact and clinical care is recommended when. Option A hands are visibly soiled. Option B caring for patients with vomiting or diarrheal illness, regardless of whether or not gloves have been worn. Option C immediately after contact with body fluids, mucous membranes, and non-intact skin. The correct answer is C. Question 90. What are the signs and symptoms of shock during early stage 1 to 3? Option A, hypoxemia. Option B, tachycardia and hyperventilation. Option C, hypotension. Option D, all of the above. The correct answer is D. Question 91. In the context of assessing risks prior to moving and handling, what does TILE stand for? Option A, tasked individual lift environment. Option B, tasked intervene load environment. Option C, task intervene load equipment. Option D, task individual load environment. The correct answer is D. Question 92. For which of the following modes of transmission is good hand hygiene a key preventative measure? Option A, airborne. Option B, direct and indirect contact. Option C, droplet. Option D, all of the above. The correct answer is D. Question 93. What medications would most likely increase the risk for fall? Option A, loop diuretic. Option B, hypnotics. Option C, beta blockers. Option D, NSAIDs. The correct answer is B. Question 94. How many phases of carot cough sounds are there? Option A, 3. Option B, 4. Option C, 5. Option D, 6. The correct answer is C. Question 95. You can delegate medication administration to a student if: Option A, the student was assessed as competent. Option B, only under close, direct supervision. Option C, the patient has only oral medication. The correct answer is B. Question 96. If a patient has been assessed as lacking capacity to make their own decisions, what government legislation or act should be referred to? Option A, Health and Social Care Act 2012. Option B, Mental Capacity Act 2005. Option C, Carers Equal Opportunities Act 2004. Option D, all of the above. The correct answer is B. Question 97. If a patient is prescribed nebulizers, what is the minimum flow rate in liters per minute required? Option A, 2 to 4. Option B, 4 to 6. Option C, 6 to 8. Option D, 8 to 10. The correct answer is C. Question 98. Why are physiological scoring systems or early warning scoring systems used in clinical practice? Option A. They help the nursing staff to accurately predict patient dependency on a shift-by-shift basis. Option B. The system provides an early accurate predictor of deterioration. By identifying physiological criteria that alert the nursing staff to a patient at risk. Option C. These scoring systems are carried out as part of a national audit, so we know how sick patients are in the United Kingdom. Option D. They enable nurses to call for assistance from the outreach team or the doctors via an electronic communication system. The correct answer is B. Question 99. When you tell a third-year student under your care to dispense medication to your patient, what will you assess? Option A, whether S.E. he is able to give medicine. Option B, whether S.E. he is under your same employment. Option C, his or her competence and skills. Option D, supervise directly. The correct answer is C. Question 100. You are caring for a patient who has had a recent head injury, and you have been asked to carry out neurological observations every 15 minutes. You assess and find that his pupils are unequal and one is not reactive to light. You are no longer able to rouse him. What are your actions? Option A, continue with your neurological assessment. Calculate your Glasgow Coma Scale (GCS) and document clearly. Option B, this is a medical emergency. Basic airway, breathing and circulation should be attended to urgently and senior help should be sought. Option C, refer to the neurology team. Option D, break down the patient's Glasgow Coma Scale as follows. Best verbal response V equals 20. Best motor response M equals 20. And eye opening E equals XX. Use this when you hand over. The correct answer is B. Question 101. What is atrial fibrillation? A heart condition that causes Option A, an irregular and often abnormally slow heart rate. Option B, an irregular and often abnormally fast heart rate. Option C, a regular heart rhythm with an abnormally slow heart rate. Option D, a regular heart rhythm with an abnormally fast heart rate. The correct answer is B. Question 102. You are the named nurse of Mr. Corbin, who has just undergone an abdominal surgery 4 hours ago. You have administered his regular analgesia 2 hours ago, and he is still complaining of pain. Option A, gives another dose. Option B, assist patient in a comfortable position. Option C, all of the above. The correct answer is C. Question 103. Which of the following senses is to fade last when a person dies? Option A, hearing. Option B, smelling. Option C, seeing. Option D, speaking. The correct answer is A. Question 104. You have observed Anne for catheter insertion site with erythema, swelling, pain, and warm. What VIP score would you document on his notes? Option A, 5. Option B, 2. Option C, 3. Option D, 4. The correct answer is C. Question 105. When treating patients with Clostridium difficile, how should you clean your hands? Option A. Use alcohol hand rubs. Option B. Use soap and water. Option C. Use hand wipes. Option D. All of the above. The correct answer is B. Question 106. In normal breathing, what is the main muscle S involved in inspiration? Option A. The diaphragm. Option B. The lungs. Option C. The intercostal. Option D. All of the above. The correct answer is A. Question 107. When do you gain consent from a patient and consider it valid? Option A. Only if a patient has the mental capacity to give consent. Option B. Only before a clinical procedure. Option C. None of the above. The correct answer is A. Question 108. The UK regulator for nursing and midwifery professions within the UK with a stated aim to protect the health and well-being of the public is Option A. GMC, Option B. NMC, Option C. BMC, Option D. WHC. The correct answer is B. Question 109. What do you expect to manifest with a fluid volume deficit? Option A. Low pulse, low BP. Option B. High pulse, high BP. Option C. High pulse, low BP. Option D. Low pulse, high BP. The correct answer is C. Question 110. How do we handle a specimen container labeled with a yellow hazard sticker? Option A. Wear gloves and apron and inform the laboratory that you are sending the specimen. Option B. Wear gloves and apron, mark it high risk, and send the specimen to the laboratory with your other specimens. Option C. Wear gloves and apron, inform the infection control team, and complete a DATIX form. Option D. Wear gloves and apron, place specimen in a blue bag, and complete a DATIX form. The correct answer is A. Question 111. A nurse is caring for clients in the mental health clinic. A woman comes to the clinic complaining of insomnia and anorexia. The patient tearfully tells the nurse that she was laid off from a job that she had held for 15 years. Which of the following responses, if made by the nurse, is most appropriate? Option A. Did your company give you a severance package? Option B. Focus on the fact that you have a healthy, happy family. Option C. Losing a job is common nowadays. Option D. Tell me what happened. The correct answer is D. Question 112. What does intermediate care not consist of? Option A. Maximize dependent living. Option B. Prevent unnecessary acute hospital admission. Option C. Prevent premature admission to long-term residential care. Option D. Support timely discharge from hospital. The correct answer is A. Question 113. Hospital discharge planning for a patient should start. Option A. When the patient is medically fit. Option B. On the admission assessment. Option C. When transport is available. The correct answer is B. Question 114. Causes of diarrhea in Clostridium difficile are. Option A. Ulcerative colitis is a condition that causes inflammation and ulceration of the inner lining of the rectum and colon. Option B. Hashimoto's disease, also called chronic lymphocytic thyroiditis or autoimmune thyroiditis, is an autoimmune disease. Option C. Pseudomembranous colitis is an acute exudative colitis usually caused by Clostridium difficile. PMC can rarely be caused by other bacteria. Option D. Crohn's disease is one of the two main forms of inflammatory bowel disease, so may also be called IBD. The other main form of IBD is a condition known as ulcerative colitis. The correct answer is A. Question 115. If your patient is unable to reposition themselves, how often should their position be changed? Option A. 1 hourly. Option B. 2 hourly. Option C. 3 hourly. Option D. As often as possible. The correct answer is B. Question 116. Which of these is not a symptom of an ectopic pregnancy? Option A. Pain. Option B. Bleeding. Option C. Vomiting. Option D. Diarrhea. The correct answer is C. Question 117. Where is revision on the nursing process done? During Option A. Diagnosis. Option B. Planning. Option C. Implementation. Option D. Evaluation. The correct answer is D. Question 118. What are the professional responsibilities of the qualified nurse in medicine's management? Option A. Making sure that the group of patients that they are caring for receive their medications on time. If they are not competent to administer intravenous medications, they should ask a competent nursing colleague to do so on their behalf. Option B. The safe handling and administration of all medicines to patients in their care. This includes making sure that patients understand the medicines they are taking, the reason they are taking them, and the likely side effects. Option C. Making sure they know the names, actions, doses, and side effects of all the medications used in their area of clinical practice. Option D. To liaise closely with pharmacy so that their knowledge is kept up to date. The correct answer is B. Question 119. Which client has the highest risk for a bacteremia? Option A. Client with a peripherally inserted central catheter PICC line. Option B. Client with a central venous catheter CVC. Option C. Client with an implanted infusion port. Option D, client with a peripherally inserted intravenous line. The correct answer is B. Question 120. What is primary care? Option A, the accident and emergency room. Option B, GP practices, dental practices, community pharmacies, and high street optometrists. Option C, first aid provided on the street. The correct answer is B.